Okay, good morning, BSRT3 students. Welcome back to our virtual classroom. This is again RT315 Radiation Protection. Ito na naman ako. Bibigyan ko na naman ng kahiya ng sarili ko. I hope hindi pa kayo nagsasawa sa boses ko. Ayan, online class pa more. So prior to listening to this lecture, I hope you perform the activity that is posted in your module. That is posted, of course, in your e-learning portal, in your Moodle. Okay, so this morning we are going to discuss the fundamental principles of radiation protection. I hope makinig kayo ng mabuti kasi minsan lang ako magbigay ng mga words of wisdom sa inyo. Okay, so do not be confused with the cardinal principles of radiation protection. Because here in the fundamental principles, we will focus on the justification, optimization, and the dose limitation. Sa cardinal principles kasi, we focus on the time, distance, and shielding. Okay, so as introduction, so the first American fatality that resulted from radiation exposure was Thomas Edison's assistant in the person of Clarence Dale. So since that event, a great deal of effort has been devoted to developing equipment, techniques, and procedures to control radiation levels and reduce unnecessary radiation exposure to radiation workers and the public. So therefore, as a result of Dali's death, so there have been recommendations from the different radiation protection agencies as to how we can deliver or we can carry out radiation, especially in the diagnostic procedures, safely. So, in cases of cancer and hereditary effects appear stochastically. So, I hope you still remember the difference between deterministic and stochastic effects. So, at present, the linear non-threshold model is adapted in radiological protection even for low doses, due to which the safety and the danger cannot be clearly divided. So we are here, or based on our discussion on the radiobiology, we said that linear non-threshold, that is to ensure that safety or the risk should be balanced with the benefit. Okay? So, therefore, the protection level is considered based on the idea that risk cannot be completely eliminated and on the assumption that risk cannot be tolerated. Again, it should be balanced with the benefit. So, this is the very basis on the principles of radiation protection, placing emphasis on number 1, justification, number 2, optimization, and number 3, the application of dose limits. Okay, so remember again the fundamental principles of radiation protection: justification, optimization, and application of dose limits. Okay, let's start our discussion with justification. So justification, this is the first principle is the justification of radiological protection. So this is the fundamental principle that act of using radiation is permitted only when benefits or merits outweigh the radiation risk. Remember here that nawala. Okay, remember again that the benefit should be or should outweigh the radiation risk. Kailangan mas malaki ang benefit kaysa sa risk when we introduce radiation into diagnostic use or into diagnosis and prognosis of the patient's condition. Paano natin gagawin yan? So this principle is applied not only to acts of using radiation, but also to activities that bring about changes in exposure situations. In other words, this is also applied to emergency exposure situations and existing exposure situations, as well as to plan exposure situations. Okay, sagutin muna natin yung ito. So, paano natin gagawin na yung benefit should outweigh the radiation risk? Okay, so remember that here in BS Radiologic Technology or in radiology department as a whole, we are here to give what's this to we our the use of radiation is primarily for medical purposes. So meaning medical exposures should be justified. Paano nating masasabing justifiable? Kailangan it should be by the referring medical practitioner or the attending physician of the patient. Ano ang purpose? Why mag-i-introduce tayo ng radiation? So, kailangan meron tayong very good X-ray request. So, without the X-ray request, mahirap magkaroon tayo ng procedure. So, mamaya, pag-uusapan natin yan. So again, medical exposures should be justified by the attending physician by weighing the expected diagnosis or therapeutic benefits against the radiation detriment that might cause. So the benefits and risk of available alternative techniques that do not involve radiation exposure should also be taken into account. If may mga procedure na hindi naman gagamit ng radiation na pwedeng i-introduce sa pasyente, why not i-consider yon? Kaysa dito na may radiation na pareho naman yung magiging benefit, di ba? So, yun. It depend the solution will be or dependent on the attending physician. Okay. Sige. Next. Okay, the principle is applied not only to acts of using radiation but also to activities that bring about changes in exposure situations. In other words, this is also applied to emergency exposure situations and existing exposure situations as well as to planned exposure situations. Let's take, for example, COVID-19 because we are facing really an emergency, an health emergency situation. So what if naging gold standard noon? We know for a fact that today our gold standard is RT-PCR test or the reverse transcriptase polymerase chain reaction. But there are drawbacks. Some reference said that there are 30 to 40% sensitivity because there are cases that nagkaroon muna ng 3 to 4 RT-PCR bago nalaman na may COVID-19 pala yung pasyente. Other than that, na CT scan muna and then sa CT scan na found out na may COVID-19 pala which hindi muna na-diagnose sa RT-PCR. No? So here, what if naging gold standard natin yung CT scan? Kailangan ba lahat ng population, let's say lahat ba ng na-exposed na tao kailangan i-CT scan? Sige nga. What if we said that the mass screening is now a CT scan? So mass screening of population groups involving medical exposure such as the CT scan is not justified unless, una, the expected advantages for individuals examined or it shall benefit the whole population. Pwede yun. Pwede mag-submit na lang for CT scan. Okay? But kailangan it should be beneficial to that person or to the whole population. And these are sufficient to compensate for the economic and social cost. Kung hindi naman afford ng pasyente, why not? Wag lang muna. Including the radiation detriment. So, ganun yun. Okay. So, hopefully, na-answer ko yung mga whatsoever thoughts you have in mind. Okay, so no practice involving radiation shall be adopted unless its introduction produces a positive net benefit. My question here is, since you are now BSRT3 students, you will be conducting your research. So, is it justifiable to give your patient or your subject for research to introduce radiation using the the consent? Pwede ba yon? So, the exposure of humans for medical research is not justifiable, take note, unless, first, it is accordance with the provisions of the Helsinki Declaration. Basahin nyo yun. Helsinki Declaration. And the second one, this is important, it is subject to the advice of the Ethical Review Committee or any other institutional body assigned similar functions by national authorities and to applicable national and local regulations. So I will be more strict with your research if you use living organisms such as human, animals, whatsoever. If you expose them to radiation, kailangan meron muna tayong ethics review board. Pwede kayong kumuha sa DOST. Okay, yan, pwede. So, justifiable yon kung sa board ethics review board nagsasuggest sila talagang kailangan i-introduce yung radiation pero hihingi muna tayo ng permit sa Department of Science and Technology kung pwede talagang i-introduce yung radiation sa inyong magiging specimen for research. So, klaro ba? Okay, very good. So, no practice again involving radiation shall be adopted unless its introduction produces a positive net benefit. Paano na lang, for example, nag-x-ray kayo, tapos feeling nyo may kulang. So, sa x-ray request ng doktor, pwede bang gawin yon? Pwede yon. So, any radiological examination for occupational, legal, or health insurance purposes undertaken without reference to clinical indications is not justifiable. Ito yung sinasabi ko na pwede unless, number 1, it is expected to provide useful information on the health of individual examined. For example, nakita nyo sa x-ray examination, abdominal x-ray lang. But, nakita nyo magiging useful yung chest x-ray. So, pwede yun. Okay. So, for example, patient. So, nakita nyo sa request ng doctor na left forearm. Tapos, you perform the right forearm just for comparative purposes. Very good ka dun. Kasi for mas maganda comparative purposes. Diba? So, pwede yun. Or second, justifiable then unless the specific type of examination is justified by those requesting it in consultation with the relevant professional bodies. So, hindi siya yung attending physician pero you have the radiologist. So, nag-suggest yung radiologist na gawin mo to. Very good kayo doon. It's a function of justification. So, nakuha. So, remember nyo yung mga pinagsasabi ko kasi again, minsan lang ako magbigay ng mga words of wisdom. Kaya you grab the opportunity. So, as a summary, justification, this implies that a proposed operation or practice exposure to radiation is acceptable if the total detriment is appropriately small in relation to the benefit resulting from the introduction of the proposed activity. For example, a practice involving exposure to radiation in diagnostic medicine is justified if acceptable if there is radiological examination to be performed will be useful for the patient management and his or her health status. Okay? So, sometimes kasi, nagiging practice ng ibang hospitals, to be honest naman, may mga hospitals din naman kasi na, sorry to say this, oh my God, baka ako mabash, kasi nagiging income generating yung radiology department. Sometimes medyo questionable nagkaroon ng headache tapos the request chest x-ray. Sorry na lang. Okay, so what I'm trying to say here is sometimes the institution should have a review on their protocol. Okay? Kasi sometimes, as we said, nagiging income generating yung radiology department. Okay, so that's justification lang naman. What I'm trying to say here is kailangan the introduction of radiation should be beneficial to the condition of the patient for her or his management of the disease. Okay? So kailangan, what if yung pasyente nag-refuse? Pwede ba yon? Justifiable ba yon? Hindi nyo nagagawin yung x-ray. Yes, the patient has the right to refuse. Okay, basta may black and white na talagang nagpirma siya na nagre-refuse siya for this kind of procedure para yung magkausap sila ng kanyang attending physician. So, justifiable din yun. Case-to-case basis lang yun, class. Okay? Okay, so very good. So, if you have questions, don't hesitate. We have different platforms again. So, let's come to the next. We have optimization. So, the second principle is the optimization of radiological protection. When merits of an act of using radiation outweigh risk, it is decided to use radiation by taking measures to reduce exposure as low as reasonably achievable. So, papasok dito si Alara principle because optimization is commonly known as Alara principle. So when we say optimization, so we are talking about the extent of the use of radiation. Kung pwede nating ma-stretch ang paggamit ng radiation, gagawin natin dyan. It's because of the second fundamental principle which is optimization. We have to optimize. Kailangan, kung kanina sa justification, mas mataas yung benefit kaysa sa risk, dito medyo nagkakaiba sila. Mas matimbang yung risk kaysa sa benefit of using radiation. Paano natin gagawin yon? That's the question. So, So the optimization of radiological protection means to strive to reduce exposure doses as low as reasonably achievable, while taking into account consideration social and economic balances, and does not necessarily mean to minimize exposure doses. Okay, so sa radiology department, we know for a fact that alam naman natin how to sa optimization kasi yung kailangan anong tawag nito? Kailangan hindi natin ma-compromise ang diagnostic or therapeutic outcome na pwedeng mabigay with the introduction of that radiation. Dose minimization itself is not always a benefit, and caution must be taken to ensure that the desired outcomes of the diagnostic or therapeutic services are not compromised. So, while individual dose limits do not apply to patients exposed for the purposes of diagnostic or therapy, this responsibility should include knowledge of patient doses and the implementation of appropriate dose minimization procedure. So in radiology department, we know that you are already oriented based on the principles of imaging, the combination of the appropriate KVP, MA, and the MA exposure time, and of course the SID. So to give a good quality radiograph. In other subspecialty areas like in radiation therapy, so reasonably is replaced with practicable, as low as practicably achievable, because radiation is given as much as practicable based on the computation of the dosimetrist or the radiation physicist. Oo, ganun yun. So, kailangan sa radiology, mabigay natin ang magandang quality ng image. Kung kailangan nating mag-repeat, anong gagawin? Kasi nasa alara tayo. Kung nagkamali tayo mag-x-ray, tapos uulitin natin, nagpa-follow pa ba tayo ng alara class? Yes, we still follow the alara principle. Bakit? So in consideration of the economic and social factors, strive to reduce individuals' exposure doses and number of exposed people as low as reasonably achievable. Because take note, yung mga pasyente nyo, nagbayad yan ng x-ray nag-x-ray procedure. Kung pwede, bigyan nyo naman ng magandang image. Ano? Kasi para magkaroon din naman ng magandang diagnosis. So, quality beats quantity all the time. No? Pero, the strategy, kung makukumbinsi mo siya for a repeat procedure, depends upon you. Basta, do not be afraid to take the risk here. That's the challenge of the optimization. In order to promote the optimization of radiological protection, those constraints and reference levels are utilized. Reference levels are adapted as indicators to limit individuals' doses from specific radiation sources in the contamination work, for example. So remember, okay, so a medical practitioner should be assigned in the primary task and obligation of ensuring overall patient protection and safety in the prescription of and during the delivery of medical exposure. So again, the key word here is you have to take the risk to give your patient a good quality radiograph, a good quality diagnostic service. Kung ano yung strategy mo, paano mo mako-convince na mag-submit pa siya for a repeat procedure, well, that's already your strategy. Okay? Sige. Okay. Next. The application of dose limits. So the third principle of radiological protection is the application of dose limits. The 2007 recommendation of the ICRP specified that the effective dose limit for occupational exposure, excluding radiation work and emergency, as 100 millisievert per year or per 5 years, or 5 years average, and 50 millisievert for the specific 1 year. Parang nalasing ako. So the effective dose limit for the public is specified as 1 millisievert per year. So ganun yon. So in the recent or the current recommendation of the ICRP, so it's 100 millisievert per 5 years. So that's 20 millisievert per year, average of 5 years. Mataas naman siya. Kaya bakit kailangan natin bigyan ng limit? Kasi we have to remember there's the risk. Even though we are radiation workers, even though they are public, kailangan maglagay din tayo ng limit. Okay? Na magiging safe pa din yung delivery ng radiation. Okay? So, kaya nagbigay siya ng limit. Kung baga, sabi nga nila walang forever, pero sa x-ray, may hangganan din. Okay? So, for planned exposure situations, okay, for planned exposure situations, each party with responsibilities for protection and safety shall ensure that when relevant requirements apply to that party that no practice is undertaken unless it is justified. Kaya may hangganan. For emergency naman, exposure situations, each party with responsibility for protection and safety shall ensure when relevant requirements apply to that party that protective actions or remedial actions are justified and are undertaken in such a way to achieve objectives set out in protection strategy. And for all exposure situations, each party with responsibilities for protection and safety shall ensure when relevant requirements apply to that party and that protection and safety is optimized. So those limits are the standard limits below with the total exposure to all radiation sources under management is to be controlled. The goal is not to merely keep the total exposure below those limits, but continued efforts are required to reduce, okay, that's the key, required to reduce exposure doses through further optimizing radiological protection. In this sense, dose limits do not stand for permissible exposure doses, nor they represent the threshold to divide safety and danger. Hindi porket sinabi natin sa optimization na okay lang mag-repeat, you have to keep that everyday na lang ng inyong duty. Hindi ka na magandang radtech noon, ano? Yan, nagalit tuloy si sir. Okay, so regarding medical exposure in treatment or health checkups, dose limits are not applied. This is because the application of dose limits to medical exposure may hinder patients from receiving necessary inspections or treatment and is sometimes detrimental to them. So you, as RadTech, our dose limit is only applied when occupational lang, pag nasa work tayo. Masyado naman siguro tayong makasarili kung kung isasali pa natin doon sa mga personal purposes natin, like magpapa-check up tayo, tapos magsusuot pa ba tayo doon ng occupational monitoring device, the OSL or the TLD, 'di ba? Kailangan yung dose natin should be different as worker or as patient, magkaiba sa mga iba-ibang exposure. Kaya nga nagbanggit tayo kanina ng planned, emergency, and all other exposure. So, those limits for us RadTech will be detected with the use of radiation detection devices such as the OSL here in this illustration. So accordingly, the justification is to be made from three viewpoints. The fact radiation use in medicine is more beneficial than harmful to patients. So again, sa justification, kailangan mas beneficial yung radiation kaysa sa risk. Application of specific methods to patients exhibiting specific symptoms, and application of methods customized for respective patients. And doses are to be optimized by applying diagnostic reference levels, etc. Okay, so if you have questions again, don't hesitate. We have different platforms. You can reach me through these platforms. If you still remember, we have our e-learning portal, Moodle. We have our group chat sa Facebook. And you may comment your question here in this video. So that ends my presentation for today. Next week, we are going to discuss the cardinal principles of radiation protection. So thank you so much for watching, and don't forget to like and subscribe for updates on our lectures. So that ends. See you next week and keep safe. Goodbye.